Hi. Thank you for interesting in ProNuLife VagProtect. I'm pleased to introduce and help you go through the details of ProNuLife VagProtect to see how it could definitely be your margin generator and valuable additions to your product lines. VagProtect is the best-seller Amount ProNuLife series and has been launched in Taiwan, China, Japan, Germany, Singapore, and Southeast Asia. Next, we're presenting you a short video about VagProtect. Please have a look.
Staying in hot and humid environments, wearing tight pants, using fragranced body wash to clean your vagina. Think about what would be happening if you did these things. Your intimate area stays humid and warm all day. Bad bacteria thrive in warm and damp conditions. After a shower, the fragrance covers the smell, but soon you catch that fishy odor again. These are early signs of a microbiome imbalance. The itch becomes a burn, the odor grows stronger. Girls, you don't need to put up with these anymore. Start taking care of your intimate health right now. And the good news is, what you truly need is much simpler than you thought. VagProtect has spent over 15 years on researches to formulate VagProtect helps solve the most essential problem in vagina health. It blends the golden ratio of probiotic strands that your body needs to fight against harmful bacteria and restore a balanced microbiome. Don't let vaginal problems drag you down. VagProtect is here to move you forward with confidence. Protect your vagina, fresh you all day long.
Hope you enjoy the video. Here is the global market insight about feminine intimate health. In the past few years, rising awareness of feminine intimate health is fueling global growth in the intimate care market, with a projected growth rate of over 3% and an incremental increase of $299 million from 2019 to 2024. Though fragmented, the market presents strong opportunities, especially in APAC, which will contribute 32% of total growth. A key driver is the premiumization of products, as consumers seek high-quality, science-backed solutions. As you may know, 75% of women experience intimate problems, often due to imbalances in vaginal flora or pH levels. Basically, the optimal pH for a healthy vaginal environment is between 3.8 and 4.5, which is supported by the presence of estrogen, glycogen, probiotics, and lactic acid. However, hormonal changes during menstruation, ovulation, or after intercourse can temporarily raise pH levels, increasing the risk of discomfort or infection. The most common vaginal pathogens can cause symptoms like odor, itching, and irritation. Therefore, maintaining a stable vaginal microbiome is essential, especially since over 80% of vaginal microbes are lactobacillus species that help preserve acidity and protect against harmful bacteria. A weak vaginal immunity can disrupt the balance of the vaginal microbiome, leading to discomfort and increased infection risk. When immunity is compromised, the number of beneficial bacteria, particularly lactobacillus, drops, while harmful bacteria and anaerobes proliferate. This shift raises vaginal pH above the healthy range of 4.0 to 4.5, creating an environment where pathogens can thrive. As a result, women may experience symptoms associated with bacterial vaginosis and other infections. Hormonal fluctuations and environmental changes can disrupt vaginal health by throwing off the delicate microbiome balance. Many factors could lead to shift the vaginal pH. Hormonal events like pregnancy, menstruation, and menopause also weaken immunity, making the area more vulnerable. When the pH rises above the ideal 3.8 to 4.5 range, harmful pathogens like Staphylococcus aureus, Candida albicans, and Trichomonas vaginalis can thrive, leading to unpleasant symptoms like odor, itching, and pain. Maintaining optimal pH and supporting beneficial microbes is crucial for intimate wellness. A healthy vaginal microbiota plays a crucial role in regulating and strengthening local immunity. The vaginal environment is dominated by beneficial bacteria, primarily lactobacillus, about 90%, and bifidobacterium, 9%, which help maintain acidic pH levels and prevent pathogen overgrowth. These microbes form a protective barrier along the vaginal epithelium and actively interact with immune cells. This close cooperation between the microbiome, epithelial cells, and immune system helps defend against harmful bacteria and maintain overall vaginal health. When this balance is disrupted, even the 1% of conditionally pathogenic microbes like Candida or Gardnerella can trigger infections. Antibiotics are commonly used to kill not only pathogenic bacteria but also the vaginal lactobacilli. Although they can relieve symptoms, it takes time for the vaginal microbiome to recover. Surveys have shown that most women do not fully understand the standard diagnosis and treatment. This leads to repeated episodes and can even lead to a loss of confidence in treatment. Therefore, enhancing vaginal immunity is one of the most effective solutions to preventing and managing intimate problems. While antibiotics can eliminate harmful bacteria, they often wipe out beneficial vaginal microbes like lactobacilli, allowing odor-causing pathogens to grow unchecked. Lactobacilli are essential defenders that support immunity through the production of biosurfactants, bacteriocins, and short-chain fatty acids, which inhibit the adhesion and growth of pathogens. This defense is part of the gut-vagina axis, where gut-derived microbes and metabolites play a key role in modulating vaginal health. Supporting the gut and vaginal microbiome simultaneously strengthens immune protection and helps maintain balance in the intimate area. You must wonder how probiotics can reach to vagina orally. Through oral probiotics, while improving the intestinal microecological environment, it also improves the vaginal microecological environment, two-way regulation, and more comprehensive. After probiotics enter the intestinal tract, they maintain the dominant position of beneficial bacteria by regulating the intestinal environment, killing harmful bacteria, and increasing intestinal acidity, thereby promoting the normal operation of the intestinal tract, exerting intestinal immunity, and improving systemic immunity, including vaginal immunity. Another advantage of oral administration allows probiotics to reduce the transfer of pathogen from the rectum to the vagina and reduce the risk of infection. In addition, probiotics have been shown to aggregate certain pathogens, which may be a way to prevent their adhesion, kill them by producing antibiotics, and prevent them from spreading to other areas of the vagina and bladder. So, we are proud to present you ProNewLife VagProtect, which is a targeted probiotic solution designed to support vaginal health. It features a multi-strain formula, Lactobacillus salivarius AP32, Lactobacillus rhamnosus F1 and CT53, and Lactobacillus reuteri TE33, formulated to inhibit vaginal pathogens, reduce inflammation, regulate vaginal pH, and relieve discomfort. This solution is ideal for women across different life stages, including those on their menstrual cycle, postmenopausal women, individuals with urinary tract infections, and those with high stress or irregular lifestyles. Pregnant women are advised to consult their physician before use. Recommended dosage is 15 billion CFU per day. We also recommend our customer adding Lactobacillus plantarum LPL28 because of its powerful acidity-producing ability to help inhibit pathogens. ProNewLife VagProtect features a potent blend of patented probiotic strains, each selected for their targeted support in vaginal health. Lactobacillus salivarius AP32 helps reduce vaginal inflammation, regulate immunity, and inhibit pathogens to shorten vaginitis recovery and recurrence. Lactobacillus rhamnosus F1 and CT53 offer both antivaginitis and anti-inflammatory benefits, with CT53 specifically effective against a wide range of gynecological pathogens. Lactobacillus reuteri TE33 is known for its immune-boosting properties, while Lactobacillus plantarum LPL28 supports a healthy vaginal pH by producing organic acids that inhibit harmful microbes. ProNuLife VagProtect has been scientifically shown to reduce inflammation by lowering pro-inflammatory cytokines IL-6 and IL-8. In a co-culture study using intestinal and vaginal cells, VagProtect strains demonstrated superior anti-inflammatory effects to other single strains, even LGG, confirming VagProtect's ability to modulate immune responses and strengthen vaginal cell protection. This suggests that VagProtect not only supports microbiome balance but also plays an active role in relieving inflammation and improving vaginal health. The organic acids test demonstrates the ability of specific probiotic strains to generate acidity in MRS broth, helping reduce pH and create a hostile environment for pathogens. Among the strains tested, Lactobacillus plantarum LPL28 showed the highest acid production with 2% acidity. That's the reason why we always suggest customers to add LPL28 in the blend. This strong acid-producing capability is essential for inhibiting harmful microbes and supporting vaginal microbiome balance. The results confirm that VagProtect strains are effective in establishing and maintaining an acidic environment crucial for intimate health. VagProtect strains remain active and effective even when used alongside medications. Tests show that key probiotic strains such as Lactobacillus salivarius AP32, Lactobacillus rhamnosus F1 and CT53, and Lactobacillus reuteri TE33 exhibit high resistance to clotrimazole, with inhibition zones under 4 mm, indicating strong antibiotic tolerance. Furthermore, these strains are sensitive to commonly used antibiotics like gentamicin, streptomycin, and erythromycin, ensuring safety and compatibility in clinical use. This confirms that VagProtect can be co-administered with medications to enhance its anti-inflammatory and protective effects on vaginal health without compromising efficacy. VagProtect demonstrates excellent bioavailability, maintaining high bacterial viability even under harsh gastrointestinal conditions. When exposed to acidic pH 3.5 and bile salt concentrations 0.3% over 7 hours, the total CFU count showed minimal reduction, retaining over 95% viability. This confirms that VagProtect's probiotic strains can survive the digestive tract and remain effective, making them suitable for oral administration and ensuring delivery to the target site without significant loss in potency. For your information, the decline in CFU is expressed as a logarithmic percentage. The result shows that the 4-strain combination of VagProtect has a synergistic effect which enhances the intestinal colonization ability more than double, comparing with single-strain and LGG. ProNuLife VagProtect shows superior anti-inflammatory activity compared to LGG. In a study using human PBMC-derived dendritic cells, VagProtect significantly activated anti-inflammatory cytokines TGF-beta and IL-10. At both low and high doses, VagProtect increased TGF-beta and IL-10, outperforming LGG in both cases. This demonstrates VagProtect's strong potential to regulate immune responses and reduce inflammation more effectively than commonly used probiotics, supporting its use in managing vaginal health and inflammatory conditions. ProNuLife VagProtect demonstrates significantly stronger anti-inflammatory effects compared to Biocan VagiGuard, the competition product in Taiwan. In a PBMC cell study, VagProtect drastically reduced more levels of the pro-inflammatory cytokine TNF-alpha than Biocan. Additionally, VagProtect boosted anti-inflammatory cytokine IL-10 levels, far exceeding Biocan's. These results confirm that VagProtect is more effective at suppressing inflammation and enhancing immune regulation, reinforcing its value as a superior probiotic solution for vaginal health. A 4-week preclinical trial with 32 participants, including 20 people with vaginitis, demonstrated that ProNuLife VagProtect significantly improves vaginal discomfort. Participants took 1 capsule, 5 billion CFU, twice daily, resulting in marked reductions in symptoms. The Vaginitis Symptom Rating Scale, VSRS, showed a statistically significant decrease in total scores, with notable improvements in secretion, odor, and itching and burning. No side effects were reported among healthy subjects. These findings confirm that VagProtect effectively alleviates vaginal discomfort while being safe and well tolerated. This preclinical trial gave us confidence to conduct further scale-up trial. In a 3-month clinical trial involving 100 vaginitis patients, ProNeolife VagProtect was shown to significantly improve vaginal health when used alongside metronidazole suppository, which was administered 7 days in both groups. Subjects receiving VagProtect, 5 billion CFU per sachet, 3 sachets per day, experienced a greater reduction in vaginal pH, indicating a restored acidic environment, and lower Nugent scores, reflecting decreased bacterial vaginosis. Symptom relief was faster, with shorter wearing-off times for pain, secretion, and odor compared to the control group. Additionally, inflammatory markers IL-6 and IL-8 dropped more significantly in the VagProtect group, confirming its anti-inflammatory benefits. These results highlight VagProtect's ability to reduce recurrence, regulate microbiota, and support overall vaginal health. ProNeolife VagProtect in finished product is certificated by Australia TGA Complementary Listed Medicine. Here are the patents in Taiwan, China, and the US. Published study list. VPro, the sample formula with VagProtect in sachet, is an exclusive all-in-one sachet formula designed for optimal feminine health, combining probiotics, prebiotics, and Totipro postbiotics PE0401. Each 2-gram sachet contains 10 billion CFU of clinically selected strains, including Lactobacillus salivarius, Rhamnosus, Reuteri, Plantarum, Acidophilus, and Bifidobacterium bifidum, known for regulating vaginal pH, reducing inflammation, and supporting immunity. Conveniently packed in 30 sachets per box, VPro is a premium solution targeting vaginal balance, beauty from within, and daily wellness. ProNeolife VagProtect is strategically positioned as a comprehensive solution for feminine care, supporting vaginal health through probiotic intervention. Probiotics help establish a dominant microbiome, regulate vaginal pH, prevent infections, alleviate inflammation, and reduce recurrence of vaginitis. Their mechanism includes the secretion of organic acids and bacteriocins that inhibit pathogenic bacteria, while also enhancing the body's immune and anti-inflammatory responses. VagProtect is suitable for a wide range of users, including menstruating women, postmenopausal women, those with urinary tract infections, pregnant women, with physician consultation, and individuals with high stress or irregular lifestyles. For best results, probiotics should be taken at least 2 hours apart from antibiotics and continued post-treatment to restore and maintain both intestinal and vaginal flora. Thank you, and hope you enjoy this presentation. Should you have any further question, we will be glad to discuss with you. Have a wonderful day.